Hi, I'm Todd Kiesling. I'm a certified athletic trainer here at Rejuv Medical. We're talking about shoulder problems today, and there are several videos here and on our website, some script about some of the different problems that you may encounter, as well as the shoulder anatomy, so feel free to look at those. Impingement syndrome is one of the most common shoulder problems that we run into. Impingement syndrome makes me think about someone pinching my arm. It hurts. It might bruise. Your arm might even be sore for a few days, and just from that one little pinching episode. Now, think about the structures in the tunnel above the shoulder's ball and socket joint, or the glenohumeral joint, sometimes referred to as the GH joint. Okay, that little tunnel is called the subacromial space, and it's a very small space with a lot of things in it. Okay, and imagine if the structures inside that tunnel get pinched. They may very well hurt when they get pinched, just like if someone pinches your arm. So how does that happen? As we age, the acromioclavicular, or AC joint, the area where you'd separate your shoulder, that begins to deteriorate. That's the joint right up here where you maybe have heard of somebody having a separated shoulder. That joint begins to deteriorate, and wear and tear type of arthritis, called osteoarthritis, begins. Sometimes there are little spurs that grow down from the top of the AC joint into the tunnel, from the roof of the tunnel. Other times a ligament may actually calcify and turn to bone, and that process at the end of the acromion process, or the roof of the tunnel, may cause it to begin to hook. And as you begin getting that type 2 or type 3 hooked acromion, that creates a lot less space inside the joint. Anyway, all these different conditions cause a decreased space in the tunnel, and the rotator cuff begins to get pinched. Other times we may have an injury where we fall on our arm or fall on an outstretched shoulder, and that causes the bursa sac to swell, bursitis, and we have a whole video just on that. And that may further decrease the space inside the tunnel. When any or all of these occur, it causes the structures in the tunnel to get pinched, and that's what's called impingement syndrome of the shoulder. Of course, this is a simplification of the actual physiologic process, but it gives one the idea of what that process involves. Once the tunnel space is narrowed, the rotator cuff musculature begins to swell. That's inflammation. This swelling may lead to chronic conditions like tendinitis or even tendinosis. As these progress, the cuff may begin to thin, and eventually holes may develop, leading to a significant rotator cuff disease or rotator cuff tears. When we have shoulder pain, the muscles surrounding the shoulder blade, they begin to shut down, and that causes a condition where the shoulder blade rides in a less than optimal position, often causing the space in the tunnel, the subacromial space, to narrow further. And that creates a vicious cycle of pain, kind of like a dog chasing its tail. To help fix this, specific exercises are necessary. A very cautious approach under the guidance of a physical therapist or a certified athletic trainer should be used. Occasionally, injections may be needed to help the patient through the rehabilitation process, and depending on certain factors, there may be times when rehabilitation exercises and injections are not enough. At those times, an arthroscopic surgery may be necessary, and then a decompression procedure could be performed to increase the space in the tunnel. To determine what the driving force or the root cause of shoulder pain is, the first step is an accurate diagnosis. To do that, you should call the Rejuv Medical Clinic, schedule an appointment for one of our providers to examine your shoulder. The phone number is 320-217-8480. Thanks.